Crohn's disease.
Crohn's is an inflammatory bowel disease, and it consists of inflammation that may affect any part of the gastrointestinal tract. It affects about 1 in 1,000 people in the Western world, and patients with the disease manifest with either diarrhea, abdominal pain, or weight loss, and they can sometimes have what we call extraintestinal manifestations, such as skin manifestations or joint symptoms. And at the mild end of the spectrum, Crohn's disease responds well to quite basic immunotherapies. But at the more severe end of the spectrum, the disease can be very difficult to manage, and patients in that category often require much more powerful immunotherapies with quite strong side effects in some cases, and may go on to require multiple operations.
How does it occur?
So it's thought that the disease results from a breakdown in the immune system's ability to recognise the bugs or microflora in the intestine as self, and so the immune system mounts abnormal inflammatory responses in the gut mucosa to these microorganisms. And there's also a component of mucosal barrier dysfunction, so the mucosal surface in the gut is usually protective against these microorganisms, and in Crohn's disease there's thought to be defects in that protective barrier. And another major feature of the disease is that there is a large genetic component. So it's thought that about 50% of the risk for developing Crohn's disease is inherited or genetic. And in addition to that, there are environmental factors which may precipitate the disease in certain individuals.
What's the most important lines of research that have developed in the past 5 or 10 years?
So probably the identification of a series of genetic factors which predispose to developing Crohn's disease. And these genetic factors function in innate immune sensing. That's the primitive arm of the immune system. Some of the genes are involved in sensing bacteria and in bacterial handling. There's been improvements in sequencing technologies which will allow us to probe that genetic risk further, and also investigate or identify components within the gut microflora which will facilitate disease induction.
Why does your line of research matter? Why should we put money into it?
We're involved in trying to investigate the function of these genes that have been identified as risk factors in Crohn's. And we are interested in the fact that these genes seem to be involved in innate immune pathways, that is to say the more primitive arm of the immune system, and they are involved in sensing of bacteria and degrading bacteria in the gut. So we've recently been able to show that some of these genetic variants operate in a single functional molecular pathway involved in bacterial handling in immune cells. And this pathway is defective in Crohn's patients, and that may allow persistence of bacterial components and trigger inflammation. So it's important to understand how these genetic variants operate both at a functional level and together for the development of more targeted immunotherapies and also for biomarkers of the disease.
How long does it take for these findings to translate into new treatments?
I think there are already clinical trials underway targeting some of the molecular pathways that have been uncovered as being involved in Crohn's disease, and it will obviously be years until we know whether or not these things are actually going to work or not in the clinic. I think the more we understand about the functional properties of the molecular pathways involved, the more we'll be able to design targeted immunotherapies. For example, one of the pathways that we know to be involved in autophagy. There are already drugs in the clinic which target autophagy pathways in other diseases, and it may be they have relevance or crossover in Crohn's.
How does your research fit into translational medicine within the department?
Our Crohn's research is housed in the Translational Gastroenterology unit, which is embedded in the clinical department of gastroenterology in the John Radcliffe Hospital. And it houses labs which contain the research of both scientists and clinicians, and it's with the hope that one can more quickly translate discoveries in model systems into the clinic. And the unit itself, aside from its laboratory facilities, also houses a state-of-the-art endoscopy facility and a clinical trials unit. and the gastroenterology clinical practice in the unit cares for a large cohort of Crohn's patients who have often been very actively engaged in our research effort and have been very generous in donation of their samples, and that together facilitates translation in this disease.
Thank you, Alison.